Hi, everyone. I'm Jimmy Feliciano. I'm the sales director in Central Florida and Tampa for Devoted Health. I've been with Devoted for a little bit over a year, and I've been working in the Medicare industry for 13 years. Today, I'm here to help you navigate your Medicare options. We'll be covering everything you need to know about Medicare. We'll go through some key points and explore the differences between original Medicare with a Medigap plan or a Medicare supplement plan, and Medicare Advantage. We'll also debunk myths about Medicare Advantage plans so you have all the facts. Then we'll discuss how to choose the right plan for you based on your needs and budget. We'll end by talking about timing so you know exactly when you can sign up or switch to a different plan. Let's get started with the ABCs of Medicare. When you're looking at Medicare coverage, it mostly comes down to three options. You have Original Medicare, or you can do Original Medicare with a Medicare supplement plan. And then lastly, you can also choose a Medicare Advantage plan. Original Medicare covers both Part A and Part B. Part A is hospital insurance and covers the big stuff like hospitalization, skilled nursing facility, hospice care, and home health. And Part B is medical insurance and covers routine outpatient care like preventative services, primary care and specialist visits, lab work, diagnostics, and occupational and physical therapies. But Original Medicare does not cover your prescription drugs. To get help with your prescriptions, you must get a Part D plan, which will have an additional monthly premium. If you're interested in Original Medicare, but also want an additional plan to cover some of the costs that Original Medicare doesn't cover, like co-payments, co-insurance, and deductibles, a Medicare supplement insurance policy, also called Medigap, may be right for you. Some Medigap policies also cover services that Original Medicare doesn't cover, like medical care when you travel outside the US. And with a Medigap policy, you can see any doctor that accepts Medicare without a referral. They also sometimes offer benefits like vision, but they're usually not as robust as those offered by Medicare Advantage plans, which we'll talk more about in a second. However, Medigap plans have an additional premium beyond what you pay for Medicare Part B. They don't cover prescription drug costs, and they're usually more expensive than Medicare Advantage. And that brings me to Medicare Advantage plans, also known as Part C. These are private health plans that cover all Part A and B services covered by Original Medicare, and in many cases also Part D prescription drugs. In most situations, as is the case in Florida, Medicare Advantage plans usually have a $0 premium, meaning you pay zero each month. But Medicare beneficiaries must continue to pay their Part B premium unless it's paid through the Medicare Savings Program. These plans also cover additional benefits beyond Original Medicare, known as supplemental benefits. These extra benefits include things like dental, vision, hearing benefits, and much more. At this point, I like to pause and give people a chance to request a one-on-one chat with one of our Medicare experts to learn more about Devoted Health HMO plans. You can request a consultation by clicking the raise hand button at the bottom of your screen. I'll give everyone a chance to do that now. Also, as a reminder, feel free to write in your questions and we'll answer them at the end of this presentation. Let's continue with the presentation. Now that we've gone through the Medicare ABCs, let's break down some key points and differences between Original Medicare and Medicare Advantage. With Original Medicare, you can see any doctor that accepts Medicare, and in most cases, you don't need a referral to see a specialist. You can buy supplemental coverage to help pay your out-of-pocket costs, like your deductible and coinsurance. You should also be aware that Original Medicare has coverage gaps. Let's go through a few of those. If you choose to go with Original Medicare, you'll have a deductible for Part A and B, and you'll pay a 20% coinsurance for covered Part B services. There's also no yearly limit on what you pay out of pocket. You also won't get coverage for prescription drugs, emergency services outside of the US, or supplemental benefits like dental, vision, and hearing. Let's compare that with Medicare Advantage plans that cover all of the services covered by Original Medicare, plus extra benefits that are not covered by Original Medicare, like prescription drugs, dental, vision, and hearing. And all of these services use one card and one plan to simplify your healthcare, in comparison to having different cards and different plans for medical, prescription drugs, hearing, etc. Many Medicare Advantage plans also have $0 premiums, meaning you'll pay nothing for your insurance on a monthly basis, aside from your Medicare Part B premium. Plus, some plans have low or no out-of-pocket costs for services, especially when it comes to preventative care. So you'll likely pay very little, if anything, for things like screenings and blood pressure, diabetes, and cholesterol tests. Some plans also provide worldwide emergency care coverage if you need care immediately and are out of the service area. And while we're talking about out-of-pocket costs, I should also mention that Medicare Advantage plans have a yearly limit on what you pay for Medicare Part A and B covered services. That means once you reach your plan's limit, you'll pay nothing for these services for the rest of the year. And if you remember back to the Medicare ABCs we talked about earlier, Part A and B covers big stuff like hospitalization, hospice care, and home health, as well as routine outpatient care like primary care and specialist visits, lab work, and occupational and physical therapies. So you can imagine that this yearly limit could save you big time over the course of a year. Now let's talk about which doctors you can see. In most cases, you need to use doctors who are in the plan's network. You're covered only when you see in-network providers, and you'll have to pay out of pocket if you see anyone else. You also may need to get a referral to see a specialist. Referrals are just a way to make sure your PCP knows what's going on with your health. Although it's an extra step you have to take, most plans make referrals easy. If you go with the Medicare Advantage plan, you'll want to always get one before seeing a specialist to avoid any surprise bills. And did you know enrollment in Medicare Advantage plans has nearly doubled over the past decade? It is estimated that nearly 50% of Medicare beneficiaries will sign up for a Medicare Advantage plan within the next 10 years. One of the reasons they're growing in popularity, in recent years, Medicare Advantage plans have been given the freedom to offer more comprehensive benefits not offered by Original Medicare, like transportation, in-home help, meal deliveries, and more. Medicare Advantage members also report having more positive feelings about the type of care they're receiving and the level of service they're getting from the health plan itself. And starting in 2020, Medicare Advantage plans will begin covering telehealth services for any care included under Part B, making it easier and more convenient to get the care you need. And prescription drug plan premiums have gone down significantly for Medicare Advantage beneficiaries. In fact, as you'll see in this chart, Medicare Advantage prescription drug premiums range from $26 a month for HMO enrollees to $48 a month for PPO enrollees. However, half of Medicare Advantage prescription drug plan enrollees pay no premium at all, other than the Part B premium. And your prescription drug premium rolls into what you pay overall for your health care per month. Just another reminder that if you'd like more information about devoted health plans, you can click the raise hand option at the bottom of your screen, and you'll be contacted by one of our Medicare experts within a day. Also, a reminder that you can type your questions into the chat bar, and we'll answer them at the end of the presentation. We've gone through the ABCs of Medicare and compared some of the key points of Original Medicare and Medicare Advantage. Next, let's debunk some myths you may have heard about Medicare Advantage plans. The first myth, all Medicare Advantage plans are the same. In fact, Medicare Advantage plans differ on multiple levels, like what you pay for your hospital and medical benefits, or the type and the level of supplemental benefits you get, or the prescription drugs that are covered and the corresponding costs for those drugs, or the list of contracted providers that are accepted in the network, the referral process, and the level of service you receive. Second myth, Medicare Advantage plans are the same as original Medicare. So why sign up for it? As you now know, Medicare Advantage plans are not the same as original Medicare. Let's recap Medicare Advantage plans. With an Advantage plan, you can get extra benefits not covered by original Medicare, like dental and vision and hearing and over-the-counter benefits, fitness club membership, and more. You also have predictable costs with an Advantage plan that makes it easier to budget for. Advantage plans also put a cap on your out-of-pocket costs, unlike original Medicare. That means you'll save on things like how much you pay when you go to the doctor, when you're admitted to the hospital, and what you pay for your drugs each month. Advantage plans include prescription drug coverage, in most cases at no additional costs. And they offer all these services on one card and one plan to make things easier for you. Third myth, Medicare Advantage plans offer less coverage than original Medicare for a higher premium. The truth is, Medicare Advantage plans offer more coverage than original Medicare, and in most instances at a $0 premium. However, Medicare beneficiaries must continue to pay their Part B premium unless it is paid for by the Medicare Savings Program. Also, most Medicare Advantage plans have no Part A and B deductible. They also offer prescription coverage at a $0 premium and a limit out-of-pocket spending. These are all benefits that original Medicare doesn't provide. Now that you know your options and the ways original Medicare and Medicare Advantage differ, let's talk about the 4 steps to choosing the right plan for you. First thing you should do is check all of your health costs. Of course, you want to consider doctor's visits and prescriptions, but also think beyond the basics. Do you wear glasses? Do you need a gym membership? Do you have hearing aids? Is there routine and comprehensive dental that you need to get done? Maybe you've been wanting to try acupuncture. All these things add up and may be covered by Medicare Advantage plans. Secondly, you should consider what your future needs may be. Take a good guess at this. Try to make some solid guesses about the care you might need in the coming year. For example, do you think you'll need a hip replacement in the next year? Then consider a plan with lower cost share for inpatient and outpatient hospital procedures, as opposed to a plan with higher cost share and a lower premium. Third, know your must-haves and nice-to-haves. Write down what you need in a plan. Is your doctor in network? Are your medications covered? Then add in what you like, things like help paying for hearing aids, rides to the doctor, eyewear, even acupuncture. That'll help you better compare options. And keep in mind that only 22% of Medicare Advantage plans are offering these types of extra benefits this year. So be sure to check the plan specifics to compare what plans cover what supplemental benefits. Medicare.gov has a plan finder tool you can use. And then lastly, keep track of those deadlines to make sure you don't miss your chance to change plans. We'll go into the specific dates on the next few slides, but in general, you don't want to miss your window to sign up or change plans. You could end up getting locked into a plan you're not happy with until the following year. Which brings me to my last topic of the day, when you can sign up or switch to a different plan. When you're turning 65, you have a 7-month window to sign up for Medicare. That is called your initial coverage election period. It starts 3 months before your 65th birthday and ends 3 months after your 65th birthday. So if your birthday is in August, for example, your window to sign up runs from May 1st to November 30th. If a disability allows you to sign up before age 65, you still get a 7-month window. It starts 2 years and 1 month after you first started getting disability benefits. You can sign up during that month, the 3 months before and the 3 months after. For the majority of people, you have 2 opportunities each year to change plans. The first is the annual enrollment period, which runs from October 15th to December 7th. During this window, you can choose a new MA plan or switch back to original Medicare for the next year. Then, from January 1st through March 31st, you have another opportunity to either sign up for a Medicare Advantage plan or original Medicare, but you can only change once during this period. During the rest of the year, you can only change plans if you qualify for a special election period, like if you move outside your planned service area or recently retired. For more resources, you can visit Medicare.gov to learn about your Medicare options and when you can change plans, or FloridaShine.org. Florida Shine is your state health insurance assistance program, also known as SHIP. If you want to check if you qualify for extra help or Medicaid, you can contact your Social Security office or Medicaid. Visit ssa.gov for more information. At this time, I'll remind you that if you want to know more about devoted health plans, you can click the raise hand option at the top of your screen, and you'll be contacted by one of our Medicare experts within the next day. Now, I'll take any questions from the audience. Kristen, what are the questions? All right. We have a question here about the Medicare Savings Program. We mentioned that a few times throughout the presentation. And basically, the Medicare Savings Program is for folks who have limited income and resources. And through it, you can get help from your state to pay for your Medicare costs if you meet certain conditions. There are 4 kinds of Medicare savings programs. The first is what's known as QMB, or Qualified Medicare Beneficiary. If you're eligible, the QMB program helps to pay for your Part A and Part B premiums. In addition, will help to pay for your Part A and B services as well. The other level is, the second level is known as SLMB, or Specified Low Income Medicare Beneficiaries. This helps to pay Part B premiums only. And then the third is QI, or Qualifying Individual. This also helps to pay Part B premiums only. Again, depending on where your income and resources are, if they're limited, you may qualify for one of these Medicare savings programs. Next question. So the next question we have here is there anything that qualifies you for Medicare other than disability or turning 65? There really isn't any other qualifications for it. Some folks do qualify for Medicare immediately if they have end-stage renal disease or Lou Gehrig's disease, but for the most part, you have to wait either till you're 65 or if you get Medicare because of disability after 25 months. Let me see if there's any other questions here. So we have a question here about TRICARE. If I have TRICARE, can I get an Advantage plan? The short answer is yes. If you have TRICARE, you can get an Advantage plan. There are different types of TRICARE coverage. So depending on the TRICARE coverage that you have, you may need to do a few different things. So one, depending on the TRICARE you have, Medicare Advantage and TRICARE do coordinate benefits together. And there's different ways to approach that. Best thing to do is to speak to one of our Medicare experts so that we can help you in your specific situation and in your case. Let me see if we have any other questions. So this question is, I'm a vet and have VA coverage. Any advantage to getting Medicare? The answer to that question is absolutely. you can continue to use your VA benefits at the VA facility, or you can use your Medicare Advantage plan with the doctors that are within that network. The huge benefit for someone on VA is that they get extra benefits that are not provided by Medicare or the VA. Things like dental and vision allowance for eyewear or hearing aids. You also get an allowance for over-the-counter items where you can get over-the-counter drugs and other items like that. We also, through Medicare Advantage plans, provide transportation. So there are a lot of benefits to getting a Medicare Advantage plan if you have VA that will help you get extra benefits you don't currently have with the VA. Let me pause a moment to see if anyone else has a question. Okay, I got one more here. I travel during the summer. Is MA good for me? That's a really, really good question. There are a number of different types of MA plans. You have HMOs. Generally, if you're in an HMO, you have emergency and urgent care coverage nationwide. So while you're traveling, if anything happens, you can go to the hospital or local urgent care center. If you have a PPO, with a PPO, you get the emergency and urgent care coverage nationwide as well. But additionally, you may be able to go to contracted providers in the specific state that you're in, other specialists and primary care providers as well. So it really depends on the type of Medicare Advantage plan that you have. There's different rules for different types of plans. My advice is that you speak to a local Medicare expert to help navigate that situation for your particular circumstances. Let me see if there's any other questions in the pile here. Give me a second. Next question is, I use insulin. Which benefit is better typically, original Medicare or Medicare Advantage? That's a really good question, and it just really depends upon the Part D plans available in your area and the Medicare Advantage plans available in your area. But like we said in our presentation, if you have original Medicare and you want to stay on original Medicare, you can get a standalone prescription drug plan. Most standalone prescription drug plans will have coverage for different types of insulin. So you just have to check which coverage you need, what specific insulin you take. But there are many Medicare Advantage plans today that are actually tailored for folks who are diabetics and who provide lower co-pays for insulin drugs and lower cost overall to be able to manage your diabetes. So depending on where you live, you might have one of those plans available in your area. They're known as chronic special needs plans, and also can be a big help for a lot of folks. So again, I would encourage you to speak to a Medicare expert in your area who can help you navigate that situation. At this point, we don't have any extra questions. Thank you for taking the time to listen to us and to spend time with us. If you need anything in the future, on the screen you will find our contact information. You have my personal email address. If you have any questions, you can also speak to a devoted Medicare expert at 1-800-349-1067. Thanks again for joining us, and I wish you a great day.